there. And it's good to have all these lessons as we get in practice and get in research and get in, just expressing ideas, is that sometimes people will have different points of view about what they want to perpetuate. And there's nothing wrong with that, because with an academic institution, they want to feel like it's something that they're heavily vested in, if they're going to take that on, because they can only pick so many things. But I think it's not a bad idea to have tried at something, learned some peripheral stuff, and I think that's just part of the process. Anything else that you want to impart, that you would say if you had somebody younger than you and they're thinking about joining the Young Sports Medicine Academy member, of what it's meant for you specifically in terms of any of the interactions or specific things that you think might be opportunities down the road?
Yeah, no, I think probably one of the biggest things that we've kind of talked about, and just seeing how you've incorporated medicine into your practice, is just being involved in the local community and making a big effort to kind of talk with different people, gather different ideas, continuing to learn and to grow as an individual and as a podiatric doctor. So, I think that one thing I'm going to really incorporate into practice, and as I'm going through residency, is trying to get more involved in the community, making sure I'm going to the local running store, trying to get involved in some local sports teams. I'm playing in some intramurals now. So, my co-residents and I were wearing podiatry related things, and people ask questions. So it's already starting to break into the community and they're asking questions. So I think it's just very important to always continue to show yourself, to spread the profession in general. And then ultimately, that's how we'll get our patients and spread the message of what we do as podiatrists and how we can better impact the area around us.
I think that's an excellent, astute point, because if we don't continue to differentiate ourselves with the training, especially like the training that you've had, and will come out with, will become a little bit diluted. But the thing I like that you're doing is you're not just thinking about the surgical options, which you're getting very good training. You said a level 1 trauma center, but you're also thinking about, how am I going to integrate that into my community and be relevant in my community?
Sure.
And everything that I've seen, Aaron, about the business of podiatry relates to the integrity of doing stuff that is just goodwill for the community as one of the big resources that you can provide. So the fact that you're already thinking about putting out those tentacles to develop those relationships now is, I think, outstanding.